Like the rest of the country, Siouxland is facing a surge in COVID-19 cases this summer as the more contagious Delta variant spreads. Medical experts are urging the population to get vaccinated, and that now includes pregnant women. But many stay reluctant. It's our top story now at 10.
Sophie, I spoke with one mom who actually contracted COVID-19 early in her pregnancy. She said her experience made her never want to go through something like that again.
Certain people still hesitant to get the vaccine. Pregnant women, too, were debating whether or not to get the shot.
The idea that this delicate newborn baby is going to be born with a little bit of protection, I just feel that it's the least that we can do as parents.
Abby Rook is 36 weeks pregnant. She received both doses of Moderna after contracting the virus early on in her pregnancy.
At about 7 weeks pregnant, I contracted COVID-19 and was incredibly sick. I was basically out of commission for about a week.
At the time, Rook had her hands full with a 14-month-old to take care of. She described her experience as painful and overwhelming, prompting her to get the vaccine as soon as she could.
I just realized I couldn't guarantee that I would still be protected by antibodies and different things, and I wanted to make sure that come the end of my pregnancy, things would go smoothly and that COVID wouldn't be a concern.
The antibodies cross the placenta and your baby's protected. And another reason to consider getting the vaccine in pregnancy is the benefits to your baby. The antibodies will cross in the breast milk, so not only are you protecting yourself from COVID in pregnancy, but you're protecting your baby.
Nationwide, only 22% of eligible pregnant patients have received the vaccine. Dr. Fleming says that's a surprisingly low percentage, believed to be due to the lack of data or guidance initially released by the CDC. Pregnant women were not included in initial trials by vaccine makers. Therefore, the CDC couldn't make an official recommendation. But last week, they released new safety data urging the pregnant population to get their shots.
If you look at hospitalizations now, 95% of patients who are hospitalized and dying from the virus it's because of they're unvaccinated, and it's due to Delta variant.
According to the CDC, pregnant women who contract COVID-19 are likely to have a more severe infection, be hospitalized, and need a ventilator. Contracting the virus while pregnant could also cause miscarriage or even stillbirth. Rook says thankfully she wasn't hospitalized while sick, but wants to ensure the safety of her unborn child.
We now have the responsibility to protect 2 young kids, which is kind of scary on its own, let alone in the middle of a pandemic.
Not only are you protecting yourself, but you're protecting your baby, you're protecting your family, your community, and you're helping to end the pandemic.
Dr. Fleming adds women who got the vaccine while pregnant had a higher level of antibodies in their system and in their children than those moms who did not get the shot while pregnant but did get the virus. Mallory Smith, KCAU 9 News.